Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. Here we are going to see about asphyxiants. So when we say asphyxiants, it is mostly gases. So what are those gases and how it causes asphyxia and what are the important features of those asphyxiant gases we will see here. So first is this, the classification of this asphyxiants. You have simple asphyxiants, respiratory irritants and chemical asphyxiants. So simple asphyxiants means they are simply inert gases. So if oxygen is there, if enough oxygen is there, it will not lead to any issue. If enough oxygen is there, then there will be no issue. If oxygen is not there, then it will be a big issue. Like you have the inert gases like xenon, nitrogen. All these are example for these inert gases. Along with adequate concentration of oxygen, it will not cause any trouble. But if it is not there, this will lead to a lot of trouble. So this is simple asphyxiants. Now you have respiratory irritants, which will cause irritation to the respiratory mucosa and lead to bronchorrhea and constriction and death. So these are irritation to respiratory pathway. In the respiratory mucosa, it will give irritation, increased secretion, lead to respiratory distress. So phasgene and ammonia are the most common gases which leads to irritation. So these are irritant asphyxiants. Next what we have is chemical asphyxiants. These what they will do is at cellular level, it will lead to anoxia. It will lead to asphyxia. That it will prevent oxygen uptake by the cell. So this is your chemical asphyxiants. An example for this would be your cyanide, carbon monoxide, hydrogen sulfide. All these causes chemical asphyxia. They will prevent the oxygen uptake at the cellular level and you will be getting no oxygen, resulting in anoxia. Now we will see about this carbon monoxide. So carbon monoxide, it has this very strong affinity. So it has this 200 to 250 times greater affinity to all the heme containing proteins, like iron containing proteins, all iron containing enzymes and substances. So it will get attached to hemoglobin, myoglobin, all heme containing, all containing iron containing, it will go attached towards and it will has this greater affinity so that it will not detach from that. So because of that, there will not be any hemoglobin left. So there will not be any carrier for the oxygen and the tissue's oxygen supply will be affected. So all the heme will be occupied by this. So all the hemoglobin will be occupied by carbon monoxide. So there will be nothing left for carrying oxygen. So that is why you get tissue anoxia. You will get tissue anoxia and there will be leftward shift of your oxygen curve. The oxygen curve, it will shift towards the left and it is an inert gas, like it will not have any peculiar smell, no peculiar smell. And what it will do is, it will keep on staying in your body till it is completely eliminated. It will take a long time, around 24 to 48 hours to completely eliminate from your body. Till then it will be there in your body and it will prevent oxygen release to the cell and it will cause toxicity. So elimination is the only way of treatment. You have to eliminate it from your body through breathing. This is the only way through which it can be eliminated. There is no specific antidote or nothing special that we can do prevent the toxicity. So what you can do is, so basically when you get this carbon monoxide toxicity, you can divide them into severity. So, mild, moderate and severe depending upon the signs and symptoms. So, if it is mild, so when it is mild, the concentration will be less than 30% in your blood. Your carboxyhemoglobin level will be less than 30% and there will be fatigue, malaise, headache. This is how it will initially start. You will have this headache, you will have this fatigue, you will have the headache, dizziness, confusion, blurred vision, nausea and vomiting. This is how mild symptoms will start. When it increases to 30 to 40%, you will get ataxia, syncope, tachypnea and rhabdomyolysis, because it will already attach to myoglobin also, right? Not just your hemoglobin, it will attach to myoglobin also. Because of that, you will getting rhabdomyolysis, and severe concentration is then there is more than 40% of carboxyhemoglobin. There you will get hypotension, cardiac arrhythmia, myocardial ischemia, coma, respiratory depression, non-cardiogenic pulmonary edema and seizure. So, this is the spectrum where you will be getting. If it is mild, less than 30%, there will be very minor symptoms. It becomes 30 to 40, you will be starting to experience few severe symptoms, and more than 40, there will be convulsion and coma. So, this is the spectrum of the carbon monoxide poisoning. Now, how you will diagnose the carbon monoxide poisoning is by identifying the level of carboxyhemoglobin in the blood. You have to measure the level. Okay, measure the level of carboxyhemoglobin in the blood, and depending upon the concentration, you can identify whether it is mild, moderate or severe. And management is, the only mode of management is you have to remove the patient from the exposure. Remove from exposure and source. And next is hyperbaric oxygen. Like you will be giving oxygen in higher pressure, in higher atmospheric pressure you will be giving oxygen. This will go and try to displace all the carbon monoxide from the hemoglobin. That is how you can treat. There is nothing else you can do apart from facilitating the elimination. You have to supply full oxygen, like 100% oxygen you have to supply them, and if you supply them under hyperbaric condition, under high pressure, it will be much easier, and the half-life of the carbon monoxide will reduce and it will be easily excreted and eliminated from your body. So, carbon monoxide, what it will do is, it will simply go attached to the hemoglobin, so that oxygen will not be attached and not delivered to the body. So, this is how the carbon monoxide toxicity happens, and this carbon monoxide toxicity, it is most commonly seen in closed garage. So, carbon monoxide, it happens because of incomplete combustion of carbon, right? So, this carbon monoxide, it is commonly encountered in this closed garage and closed car death. This is where you will be getting this carbon monoxide poisoning. Clear? So, first it is a chemical asphyxiant. It will prevent oxygen uptake by the cell by attaching itself to the hemoglobin, and the only mode of treatment is giving enough oxygen under high pressure. 100% of oxygen you have to give under high pressure. So, this is about carbon monoxide. Next, what we have is the post-mortem appearance. When the person dies because of this, you will be getting this cherry red color. This cherry red color hypostasis, and blood, everything will be bright red. Only very striking red color, and you will be getting to see blisters. Sometimes you will be getting to see blisters in the skin, and lung, heart, everything will be affected. You will have the edematous brain, and in the globus pallidus you will be able to see necrosis. So, this is one striking feature of this carbon monoxide poisoning, and lung will be edematous, and heart also you will be able to see lot of petechiae. So, these are the post-mortem changes that you can find in these cases. So, carbon monoxide, this globus pallidus necrosis is very important, and there are certain tests post-mortemly that you can do to find out this carbon monoxide poisoning. What are those tests? Like we normally don't do them now, but initially they were using this, so just to know the name. So, Hoppe-Seyler's test, Katayama test, Kunkel's test, Wetzel test and potassium ferrocyanide test. So, just know the name of this test. They may ask you like what are the tests for carbon monoxide poisoning. You can just name them: Hoppe-Seyler, Katayama, Kunkel, Wetzel, this potassium ferrocyanide test. Now, what we mainly do is the spectroscopic test. That is what we usually do for carbon monoxide poisoning. And whenever you send a asphyxiant poison for analysis, what you have to do is you have to preserve the lung. And how you will preserve the lung is you will tie at trachea and then you will send, like you will not just keep it open and send, you will tie the trachea, then you will cut it and then you will send it for analysis. So, this is how you will preserve the lung. And medico-legal importance is like in most of the closed garage and car deaths, this is seen. And apart from that, in burns, in most of the burns there will be increased carbon monoxide which will lead to carbon monoxide toxicity. So, in burn people may die of carbon monoxide toxicity. Instead of burn injury they may have died of this carbon monoxide toxicity also. So, this is the medico-legal importance of this carbon monoxide poisoning. So, here you have to know how it affects the tissue and what are the symptoms, what is the concentration of severity and what are the post-mortem appearances and what is the medico-legal importance. So, this is important in this carbon monoxide. Next, what we are going to see is cyanide. So, cyanide, it is used in dyeing, metal extraction, metal polishes, pesticides, photography and printing. In all the places we use cyanide. It is also known as Shields acid and prussic acid, and it has this bitter almond smell. This is very, very specific to cyanide. They will ask you which has the bitter almond smell. It is cyanide. And the ability to perceive this smell, it is present only in few people. Not everyone will be able to identify this bitter almond smell. Now, what happens to the cyanide is that mostly when it is inhaled, there will be immediate action. You will have immediate respiratory distress. So, there will be dyspnea, they will be clutching onto your throat and all. So, there will be immediate reaction. But when it is ingested, what will happen is that it will go act with the hydrochloric acid in the stomach. Then only you will be getting this cyanide released, which will lead to toxicity. So, this will lead to toxicity. And if the person is having achlorhydria, then there will not be any toxicity. But sometimes by acting with water itself the cyanide will be released, but most commonly if the person is suffering from achlorhydria, the cyanide poisoning will not happen. And what is the mechanism of action of this poisoning? It will cause inhibition of cytochrome oxidase. It will lead to histotoxic anoxia. The cytochrome oxidase will be inhibited by this. And at the cellular level, you will have anoxia. This is known as histotoxic anoxia. And what are the tests that we can use for this is Lee-Jones test, and he will have Prussian blue in this. So, Lee-Jones test, it is used in cyanide. Bitter almond smell, it is for cyanide. Mechanism of action, it will lead to cytochrome oxidase inhibition, and it is not useful in achlorhydria individuals, but sometimes it can cause toxicity in them also. And what is the main mode of treatment? That is, you have these antidote. So, what is the antidote for cyanides? You have these sodium nitrite, amyl nitrite, sodium thiosulfate. So, this is known as Eli Lilly antidote. Or you have another antidote, that is dicobalt iodide. So, all these three are given together and this is given separately. So, all four are antidote for cyanide, and these three given together, it is known as Eli Lilly antidote. You have sodium nitrite, amyl nitrite and sodium thiosulfate. And dicobalt iodide is also one of the antidote for cyanide. So, this antidote for cyanide, it is very, very important. And medico-legal importance of this is that Like in fire accidents, you may be exposed to this cyanide gas and there can be death. And this cyanide, it resists putrefaction for a long time. For a very long time, there will be no putrefaction. Okay, this will resist putrefaction. You will be able to identify cyanide in the body for a very, very long time. And if there is embalming done, this will prevent the analysis of cyanide. So, you cannot be able to find cyanide if embalming has already been done. So, before embalming, you have to take the sample for sending analysis. And if you take sample after embalming, you will not be able to detect any cyanide in that component. So, this is the medico-legal importance of cyanide. And the main thing that you have to remember is what is the mechanism of action and what is the antidote. The next PM appearance for the cyanide is that the first thing, there should be precaution, because cyanide, it will be keep on coming from the body. So, you have to be very, very cautious while operating. You have to keep a safe distance, otherwise you can get toxicity. So, that is first thing. And the post-mortem staining will be pink in color because of the excess oxygen present in the body, which will not be utilized by the cell because of this histotoxic anoxia. And while doing preservation, like how lung is preserved, you have to tie and cut, then only send it for analysis. And this cyanide, when ingested, it will lead to severe mucosal congestion and hemorrhage. This is very, very striking in cyanide poisoning. So, we have seen carbon monoxide, we have seen cyanide. Now, what we are going to see is hydrogen sulfide. So, this hydrogen sulfide, it is a very, very bad smelling gas. It has this rotten egg smell. It has this rotten egg smell, and this is also known as sewer gas and knockdown gas. So, this hydrogen sulfide, it is usually seen in sewers. So, when people go there, if the hydrogen sulfide concentration is too much, they will get knocked down, they will get unconscious and they will die because of this hydrogen sulfide. So, that is why it is known as sewer gas and knockdown gas. And the mechanism of action is similar to hydrocyanic acid. It will cause inhibition of cytochrome oxidase and histotoxic anoxia. Like the same mechanism of hydrogen cyanide will happen here. Because of that, you will be getting asphyxia, and it will also lead to irritation of mucous membrane, leading to keratoconjunctivitis, which is also known as gas eye. And when you keep on smelling that hydrogen sulfide, you will get olfactory fatigue, and there will be acute lung injury also. Because of the hydrogen sulfide inhalation, you will get this. And when the concentration goes high up, there will be dullness, sleepiness, and eventually coma. So, this is what you will be getting when the concentration keep on increasing. And if you have any coins, any metals in your pocket while being exposed to this hydrogen sulfide, there will be discoloration of that metal also. And apart from that, you will have muscular cramps and metabolic acidosis. So, these are the common symptoms that you can expect in a person who is exposed to hydrogen sulfide. You will get irritation of the mucous membrane, olfactory fatigue and acute lung injury. Then CNS depression will happen. You will have dullness, sleepiness, muscular cramps, metabolic acidosis. Everything will happen with hydrogen sulfide. And the treatment here is same as cyanide. You can also use the same antidote. All the antidote for cyanide can be used in this also. So, this is the treatment for hydrogen sulfide. And important thing in hydrogen sulfide is this post-mortem appearance. You will be getting that rotten egg smell. This rotten egg smell will be seen even in the dead bodies, and all the body, all the organs, everything will be greenish in color. So, there will be greenish discoloration of all the tissue and blood, and the blood will remain fluid. So, this is about the blood and viscera. And in the lungs, you will, because of this acute lung injury, you will be getting acute bilateral pulmonary edema, and in the brain you will be seeing edema. Severe edema will be there and it will be green color. All the grey matter, white matter, everything will become green. Like you can see the difference. It will be severely edematous along with the greenish discoloration. The medico-legal importance of this is that it is used as a detergent suicide, because like people will mix cyanide and hydrochloric acid to form this hydrogen sulfide, which will cause instant death. So it was used in Japan. They will mix the detergent and they will use the toilet cleaner, and together it will form this hydrogen sulfide gas. So it will lead to death. So this was also known as detergent suicide, and it is used as stink bomb. And there are a lot of people, lot of severe death had happened because of this hydrogen sulfide gas. So precaution must be used by the people who are working in these sewer. So this is the medico-legal importance of this hydrogen sulfide. So you will have greenish discoloration, green color hypostasis, very fluid blood, all the organs will become green, and brain will be severely edematous, and lung will also be having pulmonary edema. So these are the post-mortem changes of hydrogen sulfide. Its mechanism of action, it is similar to cyanide. So the same antidote for cyanide can be used for hydrogen sulfide also. So these are the important asphyxiant gas we have to know, and thank you for watching.